Okay, my name is Amanda Arbuthnot. I'm going to be doing my short bedside assessment video. So I'm going to perform hand hygiene and a knot. Hello, my name is Amanda. I'm going to be your student nurse for today. Let me see your armband. Could you give me your first and last name and your date of birth?
Josh Buckner, October 18th, 1998.
Awesome. Do you mind if I do just a quick assessment on you? You don't mind? Okay, awesome. Okay, so first I'm going to start with looking at your eyes. Is that all right? All right, I'm going to shine a light. If you'll just look here at my nose. It's going to be a little bright, I'm sorry. All right, good. And your eyes are reacting just like they should. And then if you don't mind to open your mouth real quick. Awesome. So your oral mucous membrane is pink and moist. All right, now if you'll take your head and you'll move to your left and then over to your right. Awesome, and there's no jugular vein distension, which is really good. So I'm going to pull this gown down. Is that okay? Awesome. All right, I'm going to listen to your lungs real quick. So whenever I put the stethoscope on your chest, if you'll just take a deep breath in for me, in and out. Alright, and I'm going to listen over here on the side too. Alright, now if you don't mind, I'm going to help you sit up and I'm going to listen to the back of your lungs. Had any problems with coughing, difficulty breathing lately?
No.
Okay, awesome. Alright, I'm just going to feel for your heartbeat real quick. Alright. I'm just going to listen to your heartbeat for a full minute, okay? Your heart rate's 58 beats per minute and it sounds great. Alright, so I'm going to pull this gown up and I'm just going to check your arms if that's alright. Let's see this arm first. I'm checking for any abnormalities. Don't see anything. Temperature is nice and warm. Skin turgor is springy. No edema. Cap refills less than 3 seconds. On this arm, same thing. You have an IV here. And it seems to be dripping well. Is it causing you any pain? There's no edema around the site. Seems to be taped well and secure. Again, no edema. Armband isn't too tight. Don't see any sores, bruising, nothing like that. No edema. Cap refills less than 3 seconds. Alright, do you care if I check your abdomen real quick? Okay. So first I'm just going to listen to your abdomen. You have some good sounds down there, which means your intestines are working real good. I'm just going to kind of feel around. You tell me if you feel any kind of tenderness, pain. Feel anything? No. Okay. When was your last bowel movement?
Yesterday.
Okay. You had any problems having bowel movements, constipation, anything?
No.
Okay. Any problems urinating? No. Okay. All right. Do you mind to roll over on your side that way for me so I can look at your back real quick? All right. Been having any pain? Any sore spots on your back?
No.
All right. I don't see any redness, any broken open skin. Your tailbone's not sore or nothing?
No.
Okay. All right. If you want to roll back for me. Alrighty, now I'm going to assess your legs, so I'm going to uncover you if that's okay. Alright, same thing, I'm going to feel for warmth. They're a little bit cooler, but they're still pretty warm to the touch. I'm going to bend your knee. Feel for any lesions of any kind. Still not feel any. There's no edema. Cap refill is still less than 3 seconds. Do the same with this leg. Don't feel for anything. We have a wound down here. We'll come back and change that later. Alright. No edema. Cap refills less than 3 seconds. Alright, straighten that leg out for me. Now, give me your hands. I'm going to have you squeeze my fingers as tight as you can. Alright, that's good. And then I'm going to feel your pulses. You have really strong radial pulses. And then I'm going to feel your pulses down here. Good pulses. Now I'm going to have you kind of raise your ankles up and then push down like you're pushing on a gas pedal. Good. Alright. Now, we're all good there. You want to cover back up?
Sure.
Alright, are you having any pain right now anywhere?
No.
Alright, can you tell me where we're at right now?
Hospital.
Okay, can you tell me what season it is outside?
Fall.
Okay. Do you know what year we're in?
2020.
Yes. Alright. Is there anything that I can get you right now?
No.
Okay. I'm going to give you this. It's your call, though. If you need anything at all, you let me know. The doctor should be doing their rounds here soon. I should be bringing in some medication within the next hour. If you need anything at all, you just give us a call, and I'll be back around to check on you. Alright, thank you. I'm going to leave. Make sure I perform hand hygiene. And then I'll swing over here and grab you my notes that I wrote down. So his pupils were equal, round, and reactive to light. They were 4 centimeters. He was alert and oriented ×3. His oral mucous membranes were pink and moist. He had no jugular vein distension. His skin turgor was springy on his arms. His upper extremity body temp was warm to the touch, and his cap refill on his fingers was less than 3 seconds. There was no edema noted in his upper or his lower extremities. There was a 20 gauge IV in his right antecubital that was infusing perfectly fine. There was no edema, no discomfort. It was taped in place well. His hand grips were strong, and they were equal bilaterally. His radial pulses were +3 bilaterally. His lung sounds were clear and breezy, with no adventitious sounds noted. His apical pulse rate was 58, with S1 and S2 sounds audible and separate. He's able to move independently. He turned with absolutely no problem. He had no signs of skin breakdown on his back. There was no irritation. His abdominal contour was flat with bowel sounds present in all 4 quadrants. His abdomen was soft with no pain present. With palpation, his last bowel movement was yesterday. He's having no problems urinating as per the patient. There's no discoloration or edema in the legs, the ankles, and feet were warm and pale. Cap refill was less than 3 seconds in the toes. Pedal pulses bilaterally were +2. Foot pushes were equal and strong bilaterally. Overall, he is a very healthy young male, appears to be. And that's all. Thank you.